As you remember, we divided our nervous system to two parts: central nervous system, which is only brain and spinal cord, and peripheral nervous system, which is the nerves and ganglia found outside of the central nervous system. We can divide the peripheral nervous system based on the direction of the signals. If the signals coming from the receptors to the central nervous system, we call this as sensory division or afferent division. So the direction of the signals is going to be from receptors found in our skin, in our joints, muscle, internal organ, toward the CNS. We call this part as sensory or afferent division. While the signals coming away from the central nervous system, going toward the effectors, we call them as motor division. As you remember, effectors can be muscles, skeletal muscle, cardiac muscle, smooth muscle, or glands. So then we can actually subdivide our motor division or the afferent division to two other subdivisions based on their effectors. If the effectors are skeletal muscle, we call this as somatic nervous system. If the effectors are cardiac muscle, smooth muscle, and glands, we call this as autonomic nervous system, which we're gonna cover autonomic nervous system in a different chapter. Just know that under autonomic nervous system, which is involuntary nervous system, we have two other divisions: sympathetic division, fight and flight, and parasympathetic division, rest and digest. We're gonna cover this autonomic nervous system in a different chapter in detail. But today we're going to talk about the peripheral nervous system. We're going to talk about the nerve and ganglia. What is a nerve? Nerve is a cord-like organ of the peripheral nervous system. The example of the nerves, like we have sciatic nerve, cranial nerve number 1, cranial nerve number 2, the optic nerve, the olfactory nerve. We have different nerves as an organ in our body. As you remember, the nerve, if you cut the nerve, you can find different nerve fascicle, which each nerve fascicle is composed of nerve fiber. So this is a picture of the nerve, which we covered this in last session, which a nerve is composed of different fascicle, and each fascicle is composed of the thousands of nerve fibers or axons, which the axons can be myelinated or unmyelinated. And also there are some connective tissue related to the nerve. If the connective tissue covering the whole nerve as an organ is called epinorium. If the connective tissue is covering each nerve fascicle is called perinorium. And if the connective tissue covering each nerve fiber or axon is called endonorium. So we discussed about the nerve structure before, and also based on their function, we divided the nerve to the mixed nerve, sensory nerve, and motor nerve. Simply motor nerves means they're going to carry impulses away from the CNS or from the CNS toward the effectors. They called motor nerve or efferent nerves. The sensory or afferent nerves are the nerves. They're going to carry the signals toward the CNS. And then mixed nerves, the nerves, they contain both sensory and motor fibers. And the best example for mixed nerves like spinal nerves, or we have some cranial nerves which they are mixed, like the cranial nerve number 10, vagus nerve, the cranial nerve number 5, trigeminal nerve. These are example of the mixed nerves. Sensory nerve, like we have optic nerve, cranial nerve number 2. We have olfactory nerve, cranial nerve number 1. They are responsible to carry only the sensory information from our nose to the brain about smelling, or from our eye to the brain about vision. Or some are purely motor nerves, like the accessory nerve, cranial nerve number 11, which gonna carry the signals from our brain to the trapezius muscle, sternocleidomastoid muscle, which are going to carry only motor information. Okay. So then the next part of the peripheral nervous system is ganglia. What is a ganglia? Ganglia is a structure which is composed of cell body of neurons, which is going to be part of the peripheral nervous system. The best example for ganglia, we have dorsal root ganglia, which we learned before in the spinal cord section. The dorsal root ganglia is part of the peripheral nervous system and related to the spinal cord, which is a sac or collection of the cell body of sensory neurons, which these neurons are unipolar neurons, which means there is only one single branch coming out of their cell body, and then they're gonna send their central process and peripheral process toward the receptors and also CNS. So this is collection of the cell body of neuron, which is going to be found in dorsal root ganglion, or we call this as dorsal root ganglia. And then also we have ganglia related to the autonomic nervous system, which is called autonomic ganglia, which the cell body of neuron in this ganglia are the motor neurons, which means we have multipolar neurons. So simply ganglia means collection of the cell body of neurons. And the best example, we have dorsal root ganglia related to the spinal cord, and which is sensory, and we have autonomic ganglia related to our autonomic nervous system, like sympathetic and parasympathetic nervous system, which is motor ganglia. Okay, the next part that we are going to discuss about is about regeneration of the nerve fibers. We discussed about regeneration of we have in our bone, regeneration if we have in our cartilage or tendon. We already know there is no regeneration for our cartilage, but remodeling is always going to happen for our bone. But what about our nerve fibers? If for any reason, like the bone fracture or any traumatic event, that we have a damage in our nerve fibers, do we have regeneration of the nerve fibers? It depends. It depends if our nerve fibers or axons are part of the peripheral nervous system or central nervous system, because in central nervous system, regeneration of the nerve fibers never happen. But if the nerve fibers or axons are going to be found in our peripheral nervous system, and also their cell body is intact, and these two ending parts of these damaged fibers are kind of close to each other, the peripheral axon may regenerate. Okay, so please make sure peripheral axon may regenerate if the soma or the cell body of damaged nerve is intact, and also these two ending parts of the damaged nerve fibers are kind of close to each other. We have a regeneration of the nerve fiber. Okay, but let's see how this regeneration gonna happen. This is a process of regeneration of the nerve fiber. The first thing that's gonna happen is that when the axon is being damaged and the cell body is intact, the first thing is gonna happen is the axon become fragmented at the injury site, which we call this as the, what is it? Wallerian degeneration. Wallerian degeneration is the name of the first process gonna happen after an axon fiber had been damaged, and it's gonna be in the process of regeneration. It means axon becomes fragmented at the injury site, as you can see here. We have fragmented axons at the site of nerve damage. The second thing, when we want to regenerate a nerve fiber, we have to clean this area. So then macrophages are the cells that they're going to be involved in regeneration of the nerve fiber. They come to this area and clean out the dead axons distal to the injury site. Then, now we have this clean area by macrophages, and then we need the Schwann cells, which Schwann cells are the glial cells. They're gonna form the myelin around the peripheral nerve or peripheral axons, and they are able to divide through mitosis, and then by division and increasing the number of the cells, they're gonna make a regeneration tube. So the third event that's gonna happen is formation of the regeneration tube by Schwann cells. When we have this regeneration tube, then the axons start to grow. Then this axon grow and regenerate, and then Schwann cell is gonna make the new myelin sheath. So this is the event gonna happen during the regeneration of a nerve fiber in the peripheral nervous system. So then you have all of this information here. So if the peripheral axon has been damaged, the first thing gonna happen is Wallerian degeneration, which means the axon become fragmented, inferior to the or distal to the injury site, and then macrophages are the cell gonna be involved in regeneration of the nerve fibers. They're gonna clean the dead axon, and then after that, by the help of the Schwann cell, the regeneration tube gonna be made. So make sure these two cells are so important for the regeneration of the nerve fibers in the peripheral nervous system, the macrophages and Schwann cells, and then the axon gonna grow inside of this regeneration tube made by Schwann cells, and then the Schwann cells gonna make the new myelin sheath. But how about the nerve fibers or axons which we have in our central nervous system? As I mentioned before, most central nervous system fibers never regenerate. But why? Because in our central nervous system, we have glial cells, which they're going to inhibit and block the regeneration of the nerve fibers. These cells are oligodendrocytes and also astrocytes. The oligodendrocyte, which these cells are responsible for formation of the myelin sheath around the axons in the central nervous system, they're gonna produce a protein, which this protein gonna inhibit the growth of the axons. So simply means they're gonna prevent the CNS fiber regeneration. And also astrocyte, which is the largest and most numerous glial cells found in the central nervous system, and they are able to divide through mitosis. They're going to just divide and increase the number of astrocytes and fill out this injury site and form the scar tissue, and which the scar tissue containing a product chondroitin sulfate, which the chondroitin sulfate also gonna block the axonal regrowth. So then you can see, because of these two cells, oligodendrocyte and astrocyte, we do not have the axon or nerve fiber regeneration in the central nervous system. Okay, so far we discussed about the peripheral nervous system, organs, which there are nerves and ganglia. So you should know the structure of a nerve, which is composed of the nerve fascicle and nerve fibers or axons, which they can be myelinated or unmyelinated. And also we discussed about the connective tissue covering the nerve as an organ, nerve fascicle, and each nerve fiber. And then we discussed about the ganglia structure, which is a sac or collection of the cell body of the neuron. And then we talked about a little bit about the regeneration of the nerve fiber. Now, when you know the structure of the nerves, let's go over the nerves which we have in our body. So we can actually divide our nerves in our body to the cranial nerve and the spinal nerve. Cranial nerves are related with the brain. The messages of the cranial nerve not going to pass through the spinal cord. And spinal nerves are the nerves which they are related to the spinal cord. So that's the reason they name this as cranial nerve and spinal nerve. So cranial nerves are related to the brain. We have 12 pairs of the cranial nerves, which some of these cranial nerves can be purely sensory, some are purely motor, and most of them are mixed nerves, which means they are going to carry both motor and sensory function. Look at this picture. Through this picture, you can see the location of the cranial nerves. You see the inferior aspect of the brain, which these 12 pairs of cranial nerves are numbered in the order that they come off the interior surface. So this is the anterior part or rostral part of the brain, caudal part of the brain, or in the posterior part. So then we can actually number these based on their location. Cranial nerve number 1, cranial nerve number 2, then we have cranial nerve number 3, number 4, number 5, 6, 7, 8, and 9, 10, 11, and 12. Each has their specific name. Cranial nerve number 1 is called olfactory nerve. Cranial nerve number 2 is called optic nerve. Cranial nerve number 3 is called oculomotor nerve. Number 4, trochlear nerve. Number 5, trigeminal nerve, which you can see is very large. So the largest cranial nerve is trigeminal nerve. Then we have abducens nerve. We have cranial nerve number 7 or facial nerve. Number 8 or vestibulocochlear nerve. Number 9 or glossopharyngeal nerve. Number 10, vagus nerve. 11 is accessory nerve, and 12 is hypoglossal nerve, which you should know their name, their specific name. You should be able to find them in a picture or model, and you should know their function. Let's have the general view of these 12 pairs of the cranial nerve and just go over them very quickly. So as you can see in these two tables, you have the cranial nerve number 1 to 12, their name and also their function. Let's start with the first one, cranial nerve number 1 or olfactory nerve. So you can see just only one yes under their function. We have two no for motor function, no for parasympathetic fibers. What does it mean, parasympathetic fibers related to the cranial nerves? In the autonomic nervous system chapter, we're going to learn about these two sympathetic and parasympathetic nerve fibers, which the parasympathetic nerve fibers, some of them gonna travel along some of the cranial nerve fibers. We have 4 cranial nerves which they can carry parasympathetic fibers. As you can see, the cranial nerve number 1 is not the cranial nerve gonna carry the parasympathetic fibers. We have 1 yes for the olfactory nerve, which means that it's gonna carry the sensory information about smelling from our nose to the brain. So it's only sensory. So if I want to count the sensory cranial nerves, we have cranial nerve number 1. Then cranial nerve number 2 or optic nerve, we have 1 yes under sensory function, which means that the cranial nerve number 2 or optic nerve is going to carry the sensory information from our eye to the brain. It's about the vision. So let's put the cranial nerve number 2 here under sensory motor, sensory 5 nerves. Then we have oculomotor nerve or cranial nerve number 3. What does it mean, oculo? Do you remember? We have orbicularis oculi muscle. Oculo means eye. And motor, it shows the function of this nerve. So oculomotor nerve or cranial nerve number 3 is a motor nerve which gonna send signals from brain to the muscles around the eye, which they're gonna control the eye movement. So we have one, yes, under motor function, and also as you can see, this cranial nerve gonna carry parasympathetic fibers. So then the nerves gonna carry the parasympathetic fibers. One of them gonna be the cranial nerve number 3 or oculomotor nerve. Then we have cranial nerve number 4 or trochlear nerve. This is also related to the eye movement. So far we have 2 cranial nerve related to the eye movement. Oculomotor cranial nerve number 3 and then trochlear nerve cranial nerve number 4. This is only motor nerve because it's gonna pass the signals from brain to the muscles around the eye for controlling the eye movement. Before going over the cranial nerve number 5 or trigeminal nerve, I'm going to introduce you to this abducens nerve, cranial nerve number 6, which is also related to the eye movement. These nerves number 3, 4, and 6 are motor nerves related to the eye movement. This is only motor as well. So if I want to categorize this based on their function, cranial nerve number 3, cranial nerve number 4, cranial nerve number 6, they are only motor nerve. Then the cranial nerve number 5 or trigeminal nerve, you can see 2 yes for the trigeminal nerve, one for the sensory function and another one for the motor function. Trigeminal nerve number 5 is related to the sensory information of our face and also to the motor signals for the muscle of mastication. Like the muscles, they're gonna control the movement of the TMJ, or they're gonna open or close the mouth during the chewing. Then we have cranial nerve number 7 or facial nerve. You can see 3 yes for the facial nerve. 1 yes for sensory function because it's gonna carry the taste information from our tongue to the brain. 1 yes for motor function as it's gonna carry the signals from our brain to the facial expression muscles, and 1 yes for the parasympathetic fibers. Let me add the cranial nerve number 7 here. The facial nerve also gonna carry the parasympathetic fibers. And then we have the vestibulocochlear nerve or cranial nerve number 8, which mostly is sensory as it's gonna carry the sensory information from our ear to the brain related to the hearing and balance. And then I can add it here as well, the cranial nerve number 8. I know you can see some under motor function, but let's consider the cranial nerve number 8 as the sensory fiber because it's going to carry mostly the information about the hearing and balance from our ear to the brain. Then we have glossopharyngeal nerve, which is cranial nerve number 9. And also you can see 3 yes under the glossopharyngeal nerve, 1 yes for the sensory, which means it's going to carry the taste information from tongue to the brain. Another one, yes for the motor function as it's going to innervate the muscle related to our throat region, pharynx, and also related to our swallowing to the brain. From the brain to these muscles. And then we have 1 yes for the parasympathetic fiber. So let me add this here. So the cranial nerve number 9 is also going to carry parasympathetic fibers. Then we have vagus nerve, cranial nerve number 10, which is kind of different because the other cranial nerves, they're gonna act in the face and neck region, but the only cranial nerve which it goes beyond the face and neck is vagus nerve. It goes to the thoracic cavity, innervate the internal organ of the thoracic cavity like lungs, trachea, and it goes to the abdominal cavity, and it's going to innervate the stomach, the intestine, the liver. So it's the I can say the longest cranial nerve. It goes beyond the head and neck. So then you can see 3 yes for the vagus nerve. 1 yes for sensory, another for motor, and another for parasympathetic fiber. So I'm going to add number 10 here. So these are the 4 cranial nerves which they're going to carry parasympathetic fibers, cranial nerve number 3, 7, 9, and 10. And then the accessory nerve is going to be categorized under motor. So this is the cranial nerve number 11, which is only has motor function. Is going to innervate the muscles responsible for movement of the head and neck. And then we have another one, which is the hypoglossal or the cranial nerve number 12, which is only motor, it has motor function. It's gonna innervate all the muscles related to the tongue. Okay, and now we're going to talk about each of these cranial nerve one by one, a little bit in detail. The first one is olfactory nerve or cranial nerve number 1 is responsible to collect the information about the smelling. So the receptors of the smelling going to be found in our nasal cavity. At the roof of the nasal cavity, we have the nasal mucosa, which is composed of the receptors responsible to collect the information about smelling. And then these receptors of the smelling, they're going to send their axons, which going to make our olfactory nerve, and these fibers going to pass through the cribriform plate of the ethmoid bone, and then they're enter to the brain. I hope you remember this structure as we discussed about this cranial bone before. We have ethmoid bone, which the ethmoid bone gonna make the part of the nasal cavity roof. So as you can see in this sagittal section of the nasal cavity, here at the superior part of the nasal cavity, we have the nasal mucosa, which it composed of the receptors. They are sensitive to the smell. They're gonna collect the sensory information, and then these axons or fibers gonna pass through the cribriform plate of the ethmoid bone. So the cribriform plate of the ethmoid bone, if you remember, it has the foramina, which through this foramina or the opening, this axon gonna pass, and then they're gonna synapse to this region of the brain, which is called olfactory bulb. So olfactory bulb is this kind of bulge region, which these olfactory fibers gonna synapse here, and then without passing through the thalamus from the olfactory bulb, these signals goes to the primary olfactory cortex. If you remember, primary olfactory cortex is gonna be found in the temporal lobe. Okay, so one more time, if you want to follow the olfactory nerve, you should start from the nasal cavity, as we have receptors in the nasal mucosa. These axons from the nasal mucosa are going to pass through the cribriform plate of the ethmoid bone and then enter to the brain. The first structure they're going to synapse is olfactory bulb. And then from the olfactory bulb, these axons going to be, or this kind of information going to be sent to the primary olfactory cortex. The primary olfactory cortex is one of the sensory area of the cerebrum, which it's going to receive this sensory information about the about the smelling. So please make sure the olfactory nerve is purely sensory nerve and is responsible for smelling or olfactory function. And it's related to the cribriform plate of the ethmoid bone, so which means if something happened and cribriform plate of ethmoid bone gonna be like damage or any fracture of this region, so it may damage the olfactory nerve as well. So then we have optic nerve or cranial nerve number 2. It's also purely sensory and it's related to the vision. So it means this sensory information comes from our eyes to the brain. So in our eye, we have the inner eye of the inner layer of the eyeball is called retinas. The retina, it has photoreceptors. So these receptors are the sensory neuron, sensitive to the vision, to the light, and then they're gonna collect the information, and then the fibers or the optic nerve gonna pass through the optic canal of the sphenoid bone, and then they're gonna converge and partially cross over at the brain and make this structure the optic chiasm. And then after optic chiasm, we have the optic tract. Before sending all of the information to the sensory area of the cortex, which is our visual cortex, occipital cortex, we have to send all of this sensory information to the thalamus. Because if you remember, thalamus is going to be our relay station, except the olfactory information, all the sensory information coming from the all part of the body, at first they should go to the thalamus, and the thalamus is responsible to distribute them to the different part of the cortex. Let's review it through this picture. So as you can see in the eyeball wall, we have the inner layer is called retinas. So the retina is contain the photoreceptors. The photoreceptor are the sensory neurons which they're gonna collect this information and send this information through the optic nerve by passing through the optic canal of the sphenoid bone to the brain. And as you can see inside of the brain, we have partially crossed over the optic nerve, which is called optic chiasm. And then from the optic chiasm, we have the optic tract. But before sending them to the visual cortex, which is going to be found in our occipital lobe, we have to send them to the thalamus. So then this all information goes to the thalamus, and then thalamus is going to send them to the visual cortex, which is our occipital lobe. Okay. Then we have oculomotor nerve. Please make sure you know the oculomotor nerve is motor nerve, or it has only motor function, because the oculomotor nerve, actually the fibers come from the midbrain, the part of our brainstem, the superior part of our brainstem, and then it's going to send all of the signals to the skeletal muscle around the eye. Make sure that I'm not asking which muscle is going to be innervated by which nerve, okay? Just simply know that the oculomotor nerve is responsible for controlling the eye movement. Make sure you know the oculomotor nerve originating from the midbrain, and by passing through the superior orbital fissure of the orbit, it's come to the muscles around the eye, and is responsible for eye movement. And also, if you remember, the oculomotor nerve or cranial nerve number 3 is one of the cranial nerves carrying the parasympathetic fibers. Then parasympathetic fibers of the oculomotor nerve is responsible to control the pupil size by constricting the iris and also controlling the lens shape. There is a reflex which we call this as pupillary reflex, which means that if you shine a light in your eye, you can see that the pupil size has going to be changed. It's going to constrict. So which is because of the parasympathetic fibers, the oculomotor nerve, which is going to control the sizes of the pupil to make sure that our retina not going to be damaged by this light. Okay, let's review the cranial nerve number 3 or oculomotor nerve by this picture. So as you can see, this cranial nerve number 3 or oculomotor nerve, which the name of this nerve is descriptive, oculo means eye, and motor, it shows the function. It comes from the midbrain, and then by passing through the superior orbital fissure, it goes to the orbit and gonna innervate the muscle, the skeletal muscle around the eye, and also it's gonna carry the parasympathetic fibers. So make sure you know the clinical testing for each nerve, cranial nerve. For example, as I mentioned, test pupillary reflex by shining the light into the eye and just looking at the pupil size. It can show if the cranial nerve number 3 or the parasympathetic fibers is working properly or not. Next, we have trochlear nerve, is also the other nerve related to the eye and is for eye movement. These fibers again come from the midbrain, and then by passing through the superior orbital fissure, they're gonna innervate the skeletal muscle around the eye. It's the only motor. It's the function is motor function, only motor function. Again, through this picture, you can see the cranial nerve number 4 or trochlear nerve, which is a very fine nerve. It comes from the midbrain, and then by passing through the superior orbital fissure, it goes to the muscle around the eye for eyeball movement. Then we have trigeminal nerve, which is the largest cranial nerve, and then it both motor and sensory. We can divide the trigeminal nerve to 3 divisions: ophthalmic division, maxillary division, and mandibular division, which each division gonna pass through the different structure or opening of the skull. And then like we have ophthalmic nerve passes through the superior orbital fissure, maxillary nerve passing through the foramen rotundum, mandibular division of the trigeminal nerve passing through the foramen ovale. These divisions gonna carry the sensory information from different parts of the face, from the forehead region, from the cheek region, from the mental region, through these 3 divisions. So the general sensory about touch, pain, all gonna be carried by the trigeminal nerve from our face to the brain. And also it has a motor division, which means it's gonna send the motor fibers from pons to the muscle of the mastication. So let's review the trigeminal nerve by this picture. So then you can see here how this trigeminal nerve, which is so large, is gonna send these 3 division, the ophthalmic, maxillary, and mandibular. So then it's gonna carry the information about the general senses like touch, pressure, pain from this region, the forehead region, the cheek region, and mental region to the brain. So it's gonna carry this sensory information from the different part of the face to the brain. And as a motor function, it's gonna send the signals from the brain to the muscle of the mastication, like masseter, temporalis muscle, the medial and lateral pterygoid muscle, which they're gonna control the jaw movement during the chewing and also speech by opening or closing the mouth. Next, we have abducens nerve, is the another nerve related to the eye movement. So it's also purely motor nerve, which is originating from the pons and still passing through the superior orbital fissure, going to the orbit and gonna innervate the skeletal muscle responsible for eye movement. So far, make sure we have 3 cranial nerve responsible for controlling the eye movement: cranial nerve number 3, 4, and 6. Then facial nerve, which the facial nerve or cranial nerve number 7. It's also descriptive, the name of this nerve. Facial nerve is the nerve which gonna innervate all the facial expression muscles, the muscles responsible for making our facial expression, like it's gonna innervate our zygomaticus muscle, it's gonna innervate our orbicularis oris muscle, orbicularis oculi muscle, all of the facial expression muscles gonna be innervated by facial nerve. And don't forget, we define 3 yes for the facial nerve, 1 yes for sensory, 1 yes for motor, and 1 yes for parasympathetic fibers. So the facial nerve or cranial nerve number 7 is gonna carry the parasympathetic fibers to the lacrimal and salivary glands, the glands which we have in our face. And then for the sensory function, is going to carry the taste information from the anterior 2/3 of the tongue to the brain. Let's find the cranial nerve in this picture. So as you can see, the cranial nerve numbers, the 7 or facial nerve, it's going to send the parasympathetic fibers to these glands, lacrimal gland, and also for the salivary glands. And then it's going to send the signals to the facial expression muscle. As you can see here, all the facial expression muscles going to be innervated by the facial nerve. And also it's going to carry the sensory information about the taste from our tongue to the brain. So it's mixed nerve, sensory, motor, and also it's going to carry parasympathetic fibers. Vestibulocochlear nerve or cranial nerve number 8, which comes from our ear. Actually, in our ear or the special senses chapter, you're going to learn about the structure of the ear, which we can define 2 separate parts: cochlear division and vestibular division for the inner ear, which it has different receptors. At the cochlear region, we have hearing receptors, and at the vestibular region, we have the receptors for balance and equilibrium. That's the reason we call this nerve as vestibulocochlear nerve, the vestibular division of the inner ear and the cochlear division of the inner ear, which is going to carry the information about hearing and then equilibrium or balance. Then just make sure you know it mostly has a sensory function, which is going to carry the information about hearing and balance from our ear to the brain. So you can see in this picture that it's our auditory nerve or vestibulocochlear nerve or cranial nerve number 8, which is related to the pons, and then it has 2 parts related to the vestibule of inner ear and also cochlear of the inner ear. Next is glossopharyngeal nerve or cranial nerve number 9, which it comes from the medulla oblongata, and then it's going to exit the skull through the jugular foramen. We can define 3 yes for the glossopharyngeal nerve, 1 yes for motor function, another one for sensory function, and another one for parasympathetic fibers. The motor function we can define for glossopharyngeal nerve is innervating the muscle of the tongue and the pharynx for swallowing. As glosso means tongue and pharyngeal, it's related to the pharynx, to the throat. Then as the sensory function, we can define the carrying taste information and also general sensory impulses from the pharynx and also posterior part of the tongue to the brain. And as the parasympathetic fibers is going to innervate the parotid salivary gland, which is the largest salivary gland going to be found anterior to our ear. Let's review glossopharyngeal nerve by this picture. So as you can see, glossopharyngeal nerve, it comes from the medulla oblongata. Then it's gonna innervate the tongue muscle related to the swallowing and also the skeletal muscle of the pharynx. Then the parasympathetic fibers, it's gonna innervate the parotid gland, and also the sensory function, it's gonna carry the general sensory and also the taste information from tongue and also pharynx toward the brain. Next, we have vagus nerve. Please make sure you understood that the vagus nerve, it's the only cranial nerve. It goes beyond the head and neck region. So far, we talked about cranial nerve number 1. It's related to the nose about smelling. Cranial nerve number 2 related to the eye about vision. Cranial nerve number 3, 4, 6 also they are related to the eye about the eye movement. Cranial nerve number 5, trigeminal nerve for the sensation of the face and also the innervation of the mastication muscle. Cranial nerve number 7 also is a facial nerve related to the face or facial expression muscles. Cranial nerve number 8 about the ear. But the vagus nerve, it goes beyond the head and neck. It goes to the thoracic cavity. It goes to the abdominal cavity. It's going to innervate the heart, lung, abdominal organs like stomach, liver. So then we are going to define again 3 yes for the vagus nerve. It has motor fibers, it has sensory fibers, and also we have to define the parasympathetic fibers gonna travel along the vagus nerve. So then you can see in this picture, the vagus nerve, it's gonna actually supply the organs of the thoracic cavity like heart, lung, and also organs of the abdominal cavity. It's gonna carry their sensory information from these internal organs to the brain, and also it's gonna, as their parasympathetic fibers, they're gonna send the signals from the brain to the like cardiac muscle or smooth muscle gonna be found in these organs, or it's gonna be related to the glands like the liver gland. Okay, it's about the cranial nerve number 10 or vagus. Next, we have accessory nerve. It's also a little bit interesting because the accessory nerve is not gonna originate from the brain. Origin of the accessory nerve is the ventral rootlet of the C1 to C5 region of the spinal cord. So let me look at this picture of the accessory nerve, which is easier to understand. So as you can see, the accessory nerve going to be made by these rootlets, which coming from C1 to C5, a region of the spinal cord. And all of these rootlets going to be joined together, make the accessory nerve. Look at this, how the accessory nerve, it goes into the brain by passing through the foramen magnum. The accessory nerve, it goes inside of the brain, and then it goes to the muscles related to the neck and head movement, like the sternocleidomastoid muscle, and also we have another one, it's trapezius muscle, and then it's only motor, it has only motor function. If you want to check the cranial nerve number 11 and make sure this work properly, you can ask the patient or the person to rotate their head or shrug their shoulder against resistance, and then by this test you can actually make sure the accessory nerve is working properly. Then we have the hypoglossal nerve or cranial nerve number 12, which it's originated from the medulla oblongata, and by passing through the hypoglossal canal, it exits the skull, and it's only it has only motor function. It's gonna innervate all the muscles of the tongue, contribute to swallowing and speech. So that is a picture that you can see how this hypoglossal nerve or cranial nerve number 12, it originates from the medulla oblongata, passing through the hypoglossal canal and goes to the tongue to innervate intrinsic and extrinsic muscles of the tongue. Okay. Do you have any questions about the cranial nerve? Okay, one more thing that makes sure you know function of each cranial nerve. If you know their function, you easily can find their clinical testing. One thing which is important to know, let me go to the facial nerve. You might heard about the Bell's palsy. The Bell's palsy, it's the damage going to be found on the cranial nerve number 7 or facial nerve, as they're going to lose, the patient going to lose some of the facial expression on one side because the facial nerve has been damaged, and as it's going to innervate this facial expression muscle. So during the Bell's palsy, let me see, I believe there should be somewhere in your picture, clinical testing. Oh, it's not. Cannot find it. Let's add. Okay. So Bell's palsy is a paralysis of the facial expression muscle. If you don't know it, so let me just Google it and find a picture of a patient with Bell's palsy. So as you can see, the Bell's palsy is actually the facial nerve palsy, which means they're gonna lose their for example, at this they have like an asymmetrical face, the part that the region, or for example, if their left facial nerve has been damaged, they're gonna lose the left side facial expression muscle. So for example, they have dropping eyelid, inability to wrinkle brow, or asymmetrical smile, or dropping the corner of the mouth, which is all about the facial nerve palsy, which mostly gonna happen at one side. Okay, then let's continue about the next part. We're gonna talk about the spinal nerve. We have 31 pairs of the spinal nerves, which the good thing is that these 31 pairs does not have their specific name. Based on their region, they're gonna come from. The spinal cord, for example, we have the cervical spinal nerve, lumbar spinal nerve, sacral spinal nerve. They do not have the specific name as we discussed about the cranial nerve, okay? So we have 31 pairs of the spinal nerves. So it means 31 at the right side, 31 at the left side. And these are mixed nerve, which means they carry both sensory and motor information. So this does not, it's not actually all of these spinal nerve, even it's cervical spinal nerve, lumbar spinal nerve, thoracic spinal nerve, all are mixed nerve. Okay, do you remember how many vertebrae do we have? 26 in adult, right? Which between these 26, we have 7 cervical vertebrae from C1 to C7. But please make sure you know we have 8 cervical spinal nerve from C1 to C8. But the other gonna be the same as the number of vertebrae. We have 12 thoracic vertebrae from T1 to T12, and now we have 12 thoracic spinal nerve from T1 to T12. We have 5 lumbar vertebrae, L1 to L5, and we have 5 lumbar spinal nerve, L1 to L5. In adult, we have just one piece of sacrum, which we know before they were 5 S1 to S5 vertebrae. They just joined together, and then now we have one piece, but we still have 5 sacral spinal nerve, S1 to S5. And then we have one coccygeal nerve. So if you add all of this, we have 31 pairs of the spinal nerve, but 26 vertebrae. You know, the spinal cord is gonna pass through the vertebral foramen or vertebral canal, right? So if you look at each vertebrae and you're gonna find one foramen or one opening at each vertebra, which is called ventral foramen, vertebral foramen or okay. I can see a question in chat box. Is Bell's palsy a result of a stroke? The Bell's palsy can be a result of a cold, actually, or for example, a damage in the facial nerve. So it can be like outside of the brain, because when we say stroke, it means something should happen for our brain. It might be because of the stroke, but mostly the Bell's palsy gonna happen like in the face region. For example, when I work at the physical therapy part before, I had a patient which because of like some damage that her husband actually like hit the keychain to her face, and then it damaged her facial nerve and she got the Bell's palsy. Or I had a patient after the getting cold, she had, because of the infection, it's gonna be around the ear, it's actually damaged the facial nerve or the cranial nerve, number 7. The two scenario which I just saw by my eyes, it was not because of the stroke, but might be because of a stroke, but it can be the like environmental as well. But anyway, thank you for asking question. And then let's go over the spinal nerve. So you know the spinal cord gonna be found in vertebral canal or vertebral foramen. And the spinal nerves coming out of the spinal cord. But how the spinal nerve gonna exit the vertebrae? You remember that we have intervertebral foramen, the opening between vertebrae, which through this opening between the vertebrae, which calls intervertebral foramen, these spinal nerves coming out. Okay, now let's see how these 31 pairs of spinal nerves coming out from this intervertebral foramen. Okay, so let's start with the cervical region, as we have 7 cervical vertebrae, C1, C2, C3, C4, C5, C6, and C7 cervical vertebrae, while we have C1 to C8 cervical spinal nerve. The cervical spinal nerve from C1 to C7, they comes out above each same number as their vertebrae. For example, the C1 spinal nerve, it comes out above the C1 vertebrae. The C2 spinal nerves comes out above the C2. C3 spinal nerves comes out above C3, C4, C5, and also C6 and C7 comes out above the C7, but after the C7, we have T1 vertebrae, right? T2, T3, T4, and so on. Then look at this. From C8, it comes below the C7. T1, it comes out below the T1. T2 comes out below the T2. Okay, so it means that except C1 to C7, other cervical, other spinal nerves come out below the same number as their vertebrae. Okay. So you have this here, the only 7 cervical vertebrae. We have 8 pairs of the cervical spinal nerve, so it means 7 exit vertebral canals superior to the vertebra for which named, but 1 exit a canal inferior to C7, which is our C8. The other vertebra exit inferior to the vertebra for which named, other cervical, spinal nerve. One more thing. Let's use this fact to know how the coda equina gonna be made. If you remember, the coda equina is a collection of the spinal nerves gonna be found within the vertebral canal after the spinal cord had been ended. So we know the spinal cord gonna be ended here at the level of L1 or L2, right? But still we have this spinal nerve because they are gonna look for their appropriate vertebrae number to go out below the same number. For example, if this is L3, it goes down to find L3 and then comes out. The L4 lumbar spinal nerve, it finds the L4 and comes out below the L4, L5, below the L5, S1, below the S1, S2, S4, S5. So then this horse tail or the coda equina, which is the collection of the lumbar and spinal nerve, going to be found inside of the vertebral canal after we do not have the spinal cord and a spinal cord has been ended at the level of L1 or L2. Okay, do you have any question? So then you can see here, we have these C1 to C8 cervical nerves, T1 to T12 thoracic nerves, L1 to L5 lumbar nerves, S1 to S5 sacral nerves, and 1 coccygeal nerves, which most of the lumbar nerve and sacral nerve and coccygeal nerve going to be found in the coda equina, as they are going to find the appropriate vertebrae to come out between those or below the same number as their vertebrae. Okay, then we discussed about the spinal cord, the dorsal horn, ventral horn, and also you should remember, we discussed about the dorsal root and ventral root. Dorsal root is related to the dorsal horn and it's going to carry the sensory information to the spinal cord, and ventral root is related to the ventral horn as it's gonna carry away signals or impulses from the spinal cord to the effectors. So then we know this dorsal root and ventral root join together and make our spinal nerve. So spinal nerve is so short. Just this region is called the spinal nerve because it's immediately after blood passing through the intervertebral foramen, it branches to 2. The posterior or an anterior branches, which we call them as dorsal ramus and ventral ramus. Dorsal ramus is much thinner. It goes to the posterior structures, to the skin and muscle of the back of the body. But ventral ramus is much larger and it can make some nerve plexus. Let me go back to this picture. Most of the cervical nerve, lumbar nerve, sacral nerve, and coccygeal nerve going to be involved in making the plexus, the nervous plexus, which we have 4 nervous plexus in our body. We have cervical plexus related to the neck region, brachial plexus, which is going to make some branches innervate the muscles, skin of the upper limb. We have lumbar plexus, which is gonna innervate the muscles and skin of the lower leg, mostly the anterior part. The sacral plexus also is gonna innervate the structures of the lower leg, mostly the posterior part. So this cervical plexus, brachial plexus, lumbar, and sacral plexus is going to be made by joining the ventral rami of the spinal nerves. But as I mentioned, the cervical, lumbar, and sacral and coccygeal nerves gonna be involved. But thoracic nerves T1 to T12, they're not gonna join together and make this the plexus. Each gonna pass between the ribs and they're gonna be called as intercostal nerves. So the intercostal nerves are the ventral ramus of the T1 to T12, which they're gonna pass through the intercostal or through the costal groove or intercostal space, which is the space between the ribs, and they're gonna innervate the intercostal muscles. Now we're gonna talk about these plexus a little bit. The first plexus is cervical plexus, which it's related to the neck region. It's gonna innervate the structures of the neck and also the head. So it's gonna innervate the skin of the neck, ear, back of the head, shoulder, and also it's gonna innervate the neck muscles because we know all of these nerve fibers are mixed, right? So the the cervical plexus, it's going to be made by ventral rami of the C1 to C4 spinal nerve. As you can see here in this picture, it shows how the ventral ramus of C1, C2, C3, C4 just join together and make the other branches, the other nerves. For example, you can see this name, lesser occipital nerve, greater auricular nerve, transverse cervical nerve, ansa cervicalis. So these are the nerve related to the cervical plexus. But I want you guys to know only one. Make sure you know the phrenic nerve, which is a nerve, it goes to the thoracic cavity and gonna innervate our diaphragm, is a branches of the cervical plexus. So in this table also you can see the branches of the cervical plexus, but again, I'm not gonna asking the name of these nerves, okay, just to make this a little bit easy and simple. I want you guys to know just the phrenic nerve, which is responsible to innervate the diaphragm and it's the branches of the cervical plexus. Next, we have brachial plexus is related to innervate the skin and also muscle of the upper limb. And most of these nerve fibers which gonna make our brachial plexus comes from the ventral rami of C5 to C8. Again, if you look at this picture, these ventral rami are gonna make our brachial plexus, and then brachial plexus is gonna make these different branches. I want you guys to know this name, axillary nerve, which is gonna be found like around the neck of the humerus, and also it's gonna actually innervate the muscle around the shoulder. We have radial nerve is another branches of the brachial plexus, going to be found mostly in the radial side of the forearm. The ulnar nerve is going to be found on the the ulnar side or the medial side of the forearm. The median nerve, which is going to be found like in the median or the middle portion of the forearm. And also we have another one, musculocutaneous nerve. All of these nerves are the branches of the brachial plexus. These are the mixed nerves for motor and sensory, for different regions of the arm, forearm, hands, fingers. So I want you guys to know these 5 important nerves of the brachial plexus. Make sure you know the axillary, musculocutaneous nerve, median nerve, ulnar nerve, and radial nerve. These are the branches of the brachial plexus. I'm not asking you which muscles or which part of the like arm or forearm gonna be innervated by these nerves. Let's make it a little bit simple. Just simply know the name of these nerves which coming from the brachial plexus related to the spinal nerve, and these are the motor nerves. Then we have lumbar plexus. which the ventral rami of L1 to L4, they're going to make these lumbar plexus. And also we have the nerve, the branches coming from the lumbar plexus, which they're going to innervate the thigh muscle, the abdominal wall muscle, and psoas muscle. But make sure you know only these two nerves, femoral nerve and obturator nerve, which simply femoral nerve is going to innervate the quadriceps muscle. The muscle is going to be found on anterior compartment of the thigh. And obturator nerve, if you remember the obturator foramen, which it was an opening of the coxal bone, the obturator nerve going to pass through the obturator foramen and then goes to the thigh region. So let's look at the lumbar plexus on this image, which it shows how the L1, L2, L3, L4 ventral rami of the spinal nerve going to be involved in making the lumbar plexus. And then you can see the different name: iliohypogastric nerve, ilioinguinal nerve, genitofemoral nerve, lateral femoral cutaneous nerve. But I just want you guys to know these two important nerves, obturator and femoral nerve, which they are part of the, or the branches of the lumbar plexus, which they're gonna innervate the muscles and also skin of the anterior compartment of the thigh and also medial compartment of the thigh. Next is the sacral plexus, which the ventral rami of L4 to S4, they join together and make the sacral plexus and make the different branches. But the most important branches come from the sacral plexus is sciatic nerve. The sciatic nerve is the longest and also thickest nerve of the body, which it's gonna innervate the muscle of the back of the thigh, like we call this as hamstring muscle. Then when it goes to, let's look at this picture. So as you can see here, the ventral rami of the L4 to S4, they join together and make the sacral plexus. And this, you can see the different branches: superior gluteal, inferior gluteal nerve, pudendal nerve. But I want you guys to know only sciatic nerve, okay? So sciatic nerve is a very important branches of the sacral plexus. As you can see, it's gonna pass behind the thigh region. It's going to innervate the hamstring muscle group, which we have here. And then at the popliteal region, it's going to branches to two other nerves, which they are also important. We have common fibular nerve going to pass at the fibular side or lateral side of the leg. And then the tibial nerve, which going to pass at the tibial side or the medial side of the leg. So common fibular and tibial nerve also is associated with the sacral plexus. The question that you ask is the, let me see, is L4 part of the lumbar plexus and sacral plexus? The answer is yes. So I just went over the important like nerves which they're gonna make, for example, our brachial plexus or lumbar plexus. But as you can see here, still we have T1 and a little from C4, which they're gonna send some branches for the brachial plexus. So but the mostly C5 to C8. And you can see that, yes, for the lumbar plexus, we have L1 to L4. And also for the sacral plexus, we have L4 to S4. Yes, they can send these branches to both lumbar and sacral plexus. Okay, oh yeah, we finished this chapter. Yes, for this one also, make sure you know sciatic nerve is the branches of the sacral plexus, longest, thickest nerve, and then these two nerves, tibial and common fibular nerve, also related to the sciatic nerve and sacral plexus. Do you have any question? So as I mentioned before, this chapter is not part of your exam 2. We will see the question from this chapter in your exam 3 and also the next quiz that we will have. Okay, so we'll see you on Thursday for